The shoulder is an extremely important joint for us because the shoulder requires a high degree of range of motion in order to position our hand in space so that we can interact with the outside world. In order to accomplish that range of motion, there's a very complex system of muscles and tendons called the rotator cuff that allow the shoulder to move properly. The rotator cuff is a group of muscles that surround the humerus, which is the top part of the ball portion of our shoulder joint, and provide for motions like rotation at the side and elevation to bring the shoulder into multiple different positions. When a symptomatic condition of the rotator cuff occurs, the main symptom is pain. Patients often report pain in the front and the side of the shoulder, and one of the characteristic findings of rotator cuff dysfunction is nighttime pain. Patients have an extreme difficulty lying down flat, they have pain at night, and their shoulder often awakens them from sleep. In addition, patients notice that they start to lose function in the shoulder. Primarily, they have a difficult time lifting the shoulder up, as well as weakness with using the arm away from the body or in overhead type positions. Once we identify the rotator cuff as being a problem, fortunately there are several very good treatment options that are available. In most cases, when patients have chronic problems, we start with a conservative course. This may include things like injections into the shoulder using either cortisone or biologics such as PRP. Physical therapy is often very helpful to restore range of motion and function, and then we can use medications such as anti-inflammatories to help calm the bursitis that frequently accompanies rotator cuff problems and can cause pain for patients. In acute tears where patients have a normal rotator cuff and then sustain a trauma, or in patients that have failed an appropriate conservative course, we then look at surgical options to actually repair the rotator cuff. Fortunately, in 2021, we're now able to do most of these procedures using a minimally invasive arthroscopic approach, which means that rather than making a large incision over the shoulder, we're able to make some small poke holes in the shoulder and insert a camera inside. And we can then identify the problem, mobilize the rotator cuff, clean up the tissue to prepare a nice bed for healing, and then use devices called suture anchors, which allow us to actually suture the tendon back into place to reestablish normal contact between the rotator cuff and the bone. If you think you may have a rotator cuff problem, come see us here at Midwest Orthopedics at Rush. We have dedicated shoulder specialists with years of experience in managing these conditions. Many of the newer treatments that are in use for management of rotator cuff pathology have actually been developed and perfected by surgeons here at Rush, and we can provide you cutting-edge treatment to help solve your problem.